Hello, everyone, and thank you, April and Carmen, for inviting me. I think I attended the first session, last year, and in person, and it was amazing. I was so grateful that I was able to meet you all in person, and it was really fruitful. So I'm excited about this year as well. And the first conference, the first presentation is just amazing. I was literally like taking notes. I didn't get a chance to ask questions. So, um, a side note, do we get a chance to have the person's email, Mickey's email by any chance? Because I was literally busy taking notes. So if I have his email, that'd be great. I would love to like ask him the follow-up questions.
Yeah, I'm not sure if they'll allow us to email him back and forth.
Oh,
He's
okay.
a highly
Okay.
visible person, but yeah, we can definitely contact the team and ask questions from the department. He has a lot of individuals working in his department.
Okay. So thank you again. That was a question that I wanted to ask before I forget and present mine. So excuse me. Can you all see my slides? Can you see my slides? Am I sharing?
Someone says they're able to see your slides.
Okay.
I think we can send. Yeah.
Is it this one? I don't know why mine is showing like a display. Okay. Okay, perfect. Mhm. Oh
Yeah,
my.
I'll be honest
Is it?
with you. We're having some strange, it's a strange IT day out there nationally and internationally. So I'm able to see all of the speakers, all of the attendees, and I'm not able to see slides.
You were not able to? I don't know, because I have two screens. For some reason, it's like showing
Yeah.
on the other side and
Yeah,
not.
it's just a special technology day around the world.
Okay. Excuse me. Let me adjust this really quick.
Deaf people are able to see.
Pardon? This one?
Yeah, people can see your slides.
Okay, perfect. So I won't be able to use it for projections if that's okay, because I feel like that messes up um my screen at least. So hello everyone. I go by Coco and I'm currently a PhD candidate at George Mason University. And as April introduced me earlier, I'm currently also doing my fellowship with the National Science Foundation under the NRT program, which stands for National Research Training Program. Um, Basically, what we do is every university does it differently. I cannot guarantee every university has a program with the NR National Science Foundation because you have to like there's a PI have to apply to work with them. In our school, university, one of the professor actually applied, which they got approved. So that's how I got into this NRT program with the National Science Foundation. And basically what we do is to train what you're doing with your dissertation. So everybody could be a little bit different. And you kind of also try to apply to the community so that it's actually useful and can be implemented. For my cases, it's a little bit different because my dissertation focused on late cancer diagnosis, which is prostate and breast cancer. Um, for my fellowship, I mainly focus on domestic violence, but it's a little bit so its topic is very different, but I utilize my analytical skills. So that's why I think it was still useful. But back to, if you have any question, you can always ask me, but back to this topic about my dissertation. I'm just gonna briefly talk about it because I have not defended yet, but I will tell you briefly what I'm doing. So I mainly focus on time optimization predicting of late cancer diagnosis, which focus on, again, prostate, and the second one is breast cancer. And the reason why I focus on late diagnosis is because particularly prostate and breast cancer present like a significant challenge in healthcare, which often leads to advanced disease stages and compromised patient outcomes. So my study basically underscored the critical importance of understanding factors contributing to delayed diagnosis, which is mainly late stage, such as we think that a lot of times people switched off from early stage to late stage could possibly because of limited awareness, social economic disparities, and also informed effective interventions, which is not effective when they're doing implementation. So I wanted to see like how do we prevent them from switching off from early to late. So I propose to leverage machine learning method models to predict late stage cancer, focus on gender specific differences using patient survey data, which would be the SEER-MUSH, and then also the claims data, which would be the SEER Medicare data. And in order to do the optimizations time between data collection reliable cancer stage prediction to achieve this goal. So one of the main primary research question that I focus on is, can machine learning models be built from SEER-MUSH, which is the patient survey data, and also SEER Medicare, which is the claims data, be used for predicting late stage prostate and or breast cancer predictions? Which one? And if so, which one is better? And does the time prediction matters? Because I'll explain a little bit later what do I mean by time. So the first aim is, can late cancer diagnosis be predicted? So using SEER-MUSH and SEER Medicaid data to identify factors associated with late staging patients. And this will be done by identifying patients' demographics, socioeconomic, and comorbidities that affect late stage cancer over time. And the second aim that I am looking into is, can treatment delay be predicted? So aside from, I cannot use SEER-MUSH because it's a patient survey data and it did not have any treatment information. So for the second aim, I mainly use SEER Medicare, which is a claim data, to identify factors associated with delay for both prostate and breast cancer, and also identify patients who the delay is medically justifiable. For example, if the patient has complex comorbidity, then maybe that could be a reason why they focus on the other chronic health conditions instead of focusing on their cancer issues, or they didn't even have a chance to continue to follow up with their cancer. And those delays for other reasons. And detailed examples will be shown later. And the third aim is, can cancer outcome be predicted? This one, I was able to use both SEER-MUSH and SEER Medicaid data to construct the models. So what are the motivations? Like, why is this important? Like, there's so many papers related to using machine learning models to predict prostate cancer and or breast cancer. Well, my answer to that is, first, there are a lot of study, correct, but there's not a lot of systematic comparison for using patient survey data and claims data. A lot of times they use just either or sometimes people don't really value non-clinical data, which would be patient survey data. But in my study, I want to indicated that both actually do values in different ways. And the second motivation is time, right? I mentioned earlier, like, does the time matter? And I want to know, like, because EHR, a lot of times, most of the data, clinical data, they're very time sensitive. So if the data is too old, would that still be important? Is that still could be something that could be used in order to predict the patient's health outcomes? And so wanted to study how time-related decision in data processes would affect the prediction of the quality. And the third motivation that I have was like, what patient characteristic affect cancer diagnosis, treatment, and outcomes. So basically it means like focus on prediction model, but also clinical knowledge could also be created, because when doctors only focus on claim data, or researchers only focus on claims data, a lot of times they might not understand what the patient's needs. So that's why I want to put in there and say patient information is important. That can also create different ways when they're trying to collect data for in the futures. So that's what I mean by clinical knowledge can also be created. So what are the methodology that I've used? Again, this is more of the experimental analysis that I'm doing, which I use a lot of, aside from AUC, F1 score, and accuracy, sensitivity analysis. I also did a lot of case-by-case comparison, and also collaboration, correlations to see if AUC is similar. What does that mean? Does that mean like we should use random forest model, or should we use gradient boost model? How do we know? So it's more of experimental. And when I say case by case comparison, it also means by like gender differences. Like if I use this model to apply on prostate, or I apply on breast cancer, but breast cancer, man can also have breast cancer, right? So would that make a big difference when it's male versus females? And I also try to evaluate AI fairness, because a lot of times you can have really good results for the model, but it might not necessarily be applicable for different race or ethnicities. So I did a subgroup population analysis too. And this is a examples of one of the results that I did. I want to see, so this graph actually kind of explain the time differences. So this is for prostate cancer. So you see in day 0, the AUC wasn't that great, but over time, when patients being after a patient being diagnosed for 500 days, the AUC is actually better, but as time shifts, the information about the same patients to predict the outcome is not as significant as the first 500 days, if that makes sense. So this answers one of the questions that I have is, yes, time sensitive is important, because the more information is great, but when you have information that's too old, then it might not necessarily benefit when you're trying to predict the outcomes. So what are some of my challenges? Again, I have not completed every single experimental analysis, and there's just a lot of research paper that I'm reading, and some of them were inconsistent with one another. And secondly, my background was in MHA, which is more of the policy side, and switching off to like pursuing a PhD in programming, it was like there was like a big learning curve for me. So one of the second challenges I have is programming. And thirdly is large data and complex coding can run for days and months, which I was really surprised, because I thought, you know, once your code is good, you can just run it and you're good. But it turns out, like, because claims data and with the amount of years that I'm included, I actually end up having like, I think breast cancer itself is like 40 million records. And so it took a lot of time to just run like one experiment analysis. And so the last challenge I have is like, when do I stop, right? Because I definitely want to graduate on time. So how much more experiment do I need to do in order to answer the research questions? So thank you. That's basically a snapshot of my dissertation.
Mhm. Thank you, Coco, for sharing your information about your dissertation and the data challenges and yeah, the programming and all of those things. Um, yeah, it's not easy, you know. If those of you who have worked in GIS and things like that, I know for me, GIS was my introduction into data analysis, data science skills, and things like that. No, it's not my strength. And just so you do know, if you enjoy working with data, it's a wonderful skill to have. It's highly marketable. It's very much needed in the field of informatics, right? But if you are like me and it's like it is a challenge, it's okay too. There is a place for all of us. And it took me so long to realize that, just so you know that. It really depends on what you're interested in. There is so much need for all of our skills in informatics in this field of public health. Um, Coco, could you talk a little bit about the informatics training that you experienced as a student and how it influenced your decision for your dissertation?
Yeah, absolutely. So if I understand the question correctly, it's like how does my training would affect my decision on my research? Is that what you mean?
Yeah, kind of like the linkages to like you know, we're in this case, I know we're talking more like population health. It does
Right.
have public health implications, but you know, the informatics piece, can you kind of highlight a little bit more of those skills and the training that you experienced?
And the next one. Okay, so basically, I definitely think it's important to find a mentor who is really, really into and willing, of course, to be part of it because, like I said, like a lot of my lab mates, they all graduate with computer science, so they actually could just do it by their own. And at the time, I didn't have any like coding Python knowledge. So what I did was I provide my healthcare policy knowledge and they could like for them and they in exchange is like, okay, I'm going to teach you how to code the way how we did it as an undergrad, as like when you don't have coding skills, how do we build up? So I would set up like 1 or 2 hours a week with them. They're so kind as well. They're just like, okay, we're gonna sit down and then help you code, teach you how to code. And those training, also I did a lot of training myself as well. Like I would volunteer to, help a lot of doctors or other researchers with their research study. And if I encounter some difficulties, I'll either Google or reach back to my friends who are really good at coding and also my professor who's really, really nice as well and who kind of just guide me throughout the way. So I kind of do it as I learn, like learn as I do actually. So that's how I ended up doing my dissertation and like a lot of coding in healthcare.
It's wonderful. And I think that's the most important thing, right? Working along, like learning as you work with it, right? The applying part of that is so
Yeah.
important. It gives you the context, like, why am I doing this, right? This all makes sense. Yeah.
Yeah.
Tell us, when are you planning to complete your dissertation? And yeah, what are your plans ahead?
I hope I can defend it during fall, like this fall, so I can like graduate and start to like seek job opportunity. So I definitely highly encourage people to attend conference like this one because that's how I met April and then Carmen's because I met her through another conference called AMIA. And so like with attending conferences, you never know who you're going to bump into, and you never know like people are actually really willing to help you along the side. So that's I think it's really important. And yes. that's my plan, to continue attending PHIAT and other conferences as well, network and learn. Because I definitely learned a lot, from not just the policy side, but also public health from this conference last year. And I also was able to sharpen up my research skill and writing skills. So that's how I'm really grateful that we actually published our paper, as you guys mentioned in the very beginning. That's like something very important because a lot of times, um, not every single one of person that I met in my life are willing to do that. So I'm really grateful. Like with conferences, a lot of people have similar goals. And when you have similar goals, they were willing to like teach you the stuff that you wanted to learn. So thank you, April and Carmen.